It's Dr. Idee Charles again, and I'm here on the Health Gospel channel to talk about something very, very important to our health. And that is the 5 signs we shouldn't ignore when it comes to our health. I would ask that please, if you can share this video and join as we start. 5 very important signs you should not ignore with your heart. And please, if you haven't subscribed to this channel, do that before we start. Just click on that subscribe button, like the page, and click on the notification so you can get all the updates when we upload a new video. We have new videos coming up on the Health Gospel this week, about 2 new videos. So please do not miss them. So I will just wait for a minute or two while we have people joining us. Hello, Mary. Nice to see you here. I'm just going to start very soon. So here is the video. And it's the 5 very important symptoms we should not ignore with our heart. It is live now. I don't want anybody to miss it. It's very, very educational. I'm trying to share it. Trying to share it now. I hope that we'll have our friends join us on this very important topic. So the heart is a very, very important organ in the body. Very important organ we should not ignore, the heart. So it's something that we need to talk about, we need to learn. It's something that we need to talk about. Okay. So I'm just going to start now. Okay. So the topic today is the 5 very, very important signs we should not ignore with the heart. Hello, my sister, Pastor Doris, thank you for joining. 5 very important signs we should not ignore with the heart. And why we should not ignore the signs, what goes on with the heart, and why the signs come on, and why we should not ignore the signs. This is very important, and I will tell us why. And I'm going to be talking this, I'm going to be doing this talk in terms of our heart attack, what goes on before a heart attack, because so many people, especially in Africa and narrow it down to Nigeria, where I come from, a lot of people are dying of heart attack or cardiac arrest. When they have heart attack, their heart goes into cardiac arrest and they die. I read a story a few days ago of a gentleman who collapsed and died. He held his chest and he collapsed and he died. They took him to the village. They said somebody killed him, and there was a lot of confusion. The youth went on rampage. They said that somebody's killed their young person, and in that process they killed so many other people. Nobody asked a question, could this guy have had a cardiac arrest? Could he have just suddenly died? Because that's how we are dying these days in our country. People just suddenly collapse and die. People just die. Nobody cares, nobody wants to know. People just collapse and die. So today I'm doing a topic on the 5 important signs we should not ignore. And I'm going straight on to the point. What I'm going to talk about is with the heart, you have what is called coronary heart disease. And this is the leading cause of death worldwide. Coronary heart disease. What is coronary heart disease? The heart itself pumps out blood to the rest of the body. The heart is the big organ that pumps out blood. So it stores blood. Blood that circulates through the system takes up all the bad oxygen called carbon dioxide, and then it brings it into the heart. It goes through a system, it gets oxygenated, and then the blood is rich again to go around the body. So the heart pumps this blood out into different blood vessels. I call them pipes, different pipes that carry blood to the rest of the body, to the brain, to all your organs, to your eye, to your mouth, to your skin, to your liver, to your kidney. So the heart pumps this blood out into the rest of the body. But the heart itself is an organ, so it also needs blood. So the heart has coronary vessels, which are like pipes that carry blood that flows and supplies the heart itself, if you understand. So the heart itself pumps blood to the rest of the body, but the heart as an organ also needs this blood. So it also has blood vessels, pipes that supply blood to the heart. And that pipe is called the coronary arteries. Those are the pipes that supply blood to the heart, the coronary vessels. Now, when somebody is said to have coronary heart disease, it means that those pipes that supply blood to the heart has disease. What happens? There are accumulation of fat, cholesterol, bad things, toxin, especially in people who have chronic illnesses. And I'm going to mention these chronic illnesses. They accumulate and they form what is called a plaque, P-L-A-Q-E. They form a plaque inside this blood vessel. They form the plaque inside these blood vessels, and it narrows the pipe. So if you imagine a water pipe, a hose that was really, wide and open, and you can actually use it to pump blood and water, and it fills your gallon quickly. But when there is something blocking that lumen, that inside of that pipe, and the diameter, the inside of the pipe is narrowed. So when you plug it to the tap and you want to pump blood, the water that comes out is going to be slower. It's going to come with force. It's not free anymore to come out. So it's reduced. That is what happens to the vessels of the heart. When there's accumulation of toxins, accumulation of fat, cholesterol, it lines this pipe. So the pipe becomes narrow. Now, because the pipe becomes narrow, the inside of that pipe is weakened. Through a lot of complex mechanism, the inside of that pipe is weakened. So one day, there's just a break out of this plaque. There's a break. It breaks out and it comes out into the middle and it forms a clot. When it forms a clot, it blocks the blood flowing through this pipe to supply the heart. It blocks that vessel, that part of the blood vessel that supplies the heart. So what now happens is what we call a heart attack. A heart attack is an attack on the heart because the blood vessel that carry blood to the heart, there is a blockage. It's like having a complete block on the motorway. There is nothing going through. So there is that part of the heart that is waiting for this blood to supply me. I need oxygen, I need supply. Nothing is passing through. So that part of the muscle of the heart begins to die. And that is what we call a heart attack. And before you have a heart attack, your body will give you signs. And these are the 5 signs I'm going to be talking about today. So I've built us up to the point of what happens before a heart attack. And I'll build us up to in certain people, you will not have a complete heart attack. You have what is called angina. So that pipe is narrowed, but there is nothing blocking it completely, but it's narrowed. So if you are doing an exercise, if you are stressing your body, if you're running or you are in an activity, you can have a chest pain. Why do you have that chest pain at the time? And you say, well, I have a chest pain, or my chest is tight. You now sit down to relax and you breathe and it's back to normal again. You get up, you say, what was that? That is an angina. So an angina is when you stress the heart needs more blood at the time that you are doing an exercise, or you're doing an activity that is needing more blood. Because the blood vessel is narrow, it is unable to supply the amount of blood to the heart that the heart needs at that time. So there is some form of ischemia, which is the part of the muscle is sort of hungry for blood. So it gives you the sign of chest pain. So you feel chest pain, but when you relax, because the heart is relaxed, the blood supply is okay, the pain is gone. That is what is called angina. A lot of people have this angina and they don't do anything about it. They don't even know that they have a problem with the heart. And if you're one of these people, that if you're doing an exercise, if you're running, if you're probably cooking or you're busy and you have a sudden chest pain or a tightness or you're short of breath, but when you sit down and relax, everything is back to normal. You really, really need to get it checked because you could be having angina. You really, really need to get it checked. So this is angina. That is the form of angina, which is not a heart attack, but is building up. One day you might just have a heart attack. So with this angina, a lot of things can be done to help you, to protect you from having a heart attack. So who are the people that are at risk of coronary heart disease? There are people who have diabetes, people who have hypertension, and these are people who are not controlling any of these conditions. People who smoke, smokers, when they smoke, they produce toxins that go into these blood vessels and destroy the inner part of the blood vessels. So these are people that smoke, people that drink alcohol, people that already have other medical problems, obesity, people that have high cholesterol. These are people at risk of having a heart attack. So what are the 5 signs? Number 1, the first sign that you should never ignore with your heart is chest pain. Chest pain. Why do you have a chest pain? I've explained it now. Because the blood supply, the heart needs blood, and because your vessels are narrowed, the blood is not enough or is cut off. If you have a heart attack, there is a complete cutoff of blood supply to that part, that segment of your heart that is supplied by that vessel, because every segment of the heart has a specific vessel that supplies it. So if this vessel is cut off, if this vessel is blocked off, that part of the heart, there's no blood supply there. There's no oxygen. So that muscle begins to die. So what happens is the heart muscle is beginning to die. It presents to you as a chest pain. It's crushing. The muscle is having an injury. The heart muscle is having an injury. So you have a chest pain, and we describe it as a central chest pain. It's a crushing pain. It's not 100% of everybody that has heart attack that has a crushing chest pain. It's not everybody. A crushing chest pain is most people that have chest pain with a heart attack. And the chest pain, they tell you, is central, so it goes across the heart. They tell you the pain goes into your left arm. They tell you the pain goes into the jaw. Some say it goes into the neck. Some says I can feel the pain across my heart and into my back. These are places that this pain can be described. They will tell you they have a pain going into the neck. A lot of people I have seen patients, they tell me they have jaw pain. Since morning I've had jaw pain. and they've never had jaw pain before, it is a sign that you should never ignore. They have pain going into the left arm. It is a sign that you should never ignore. That is one sign, chest pain. Now in women, it is said, and it is studied, confirmed, that most women do not present with this typical crushing chest pain. They would tell you they have indigestion. They feel that they are having heartburns, you guys call it, heartburns. They feel they're having heartburns, but there will be other subtle signs with these heartburns, which I'm going to mention. So when a woman if you're a woman and you say, every time you say, you just wake up, suddenly you are having this pain that looks like a heartburns with these other symptoms I will mention, please do not ignore it. You need to get to the hospital. You need to be checked out. We have lost so many people, even in the developed country, even in the United Kingdom, because they ignore the signs. The second sign I'm going to mention here is shortness of breath. You cannot get your breath. It's as if your chest is so tight, you cannot breathe. Do not ignore that sign. Do not think it's a spiritual attack. Do not think somebody is after you. Do not start kabashing. Yes, God can help us, but this is serious sign that you could be having a heart attack. Do not ignore a sudden onset of chest tightness. You cannot breathe, shortness of breath. You cannot breathe. Do not ignore it. It is a severe, major sign that something is happening with your heart. The third sign I'm going to mention tonight is palpitations. What do you know? What do you call palpitations? Most people don't know what palpitations is. Palpitations is when you are aware, fully aware that your heart's beating. When you're fully aware that your heart's beating and is beating probably fast or irregular, you just feel your heart's beating. You can feel it consciously. You can actually feel that the heart's beating and you're a bit lightheaded. You feel a bit lightheaded, funny. When this is happening, do not ignore it. Ignore the sign. Now, what happened with heart attack? Sometimes there is a heart attack, and then because there is a heart attack, there is a dysrhythm. So the heart goes into an irregular rhythm. And I've talked about irregular rhythm on the Health Gospel before. When the heart goes into an irregular rhythm because of a heart attack, that irregular rhythm can be fatal. It can be very fatal. Fatal means it might not be compatible to life. So you might go into a rhythm that you might not survive in the next 30 minutes. Some people go into the rhythm that it is not just compatible to living. So if you're having palpitations once a day or it comes on and off, and you know when it comes, you feel really strange with it. You feel lightheaded. You feel strange with it. Please do not ignore your palpitations. It is treatable. There is treatment for it. If they find the rhythm that you are in, it can be treated. Don't allow this thing to go on until you have a complete heart attack, which you might not be able to be saved from, especially if you're from Nigeria. You might not be able to be saved from those type of rhythm. So you have to take this seriously. You have to take it very seriously. The third thing or the fourth sign I'm going to talk about is when you have the chest pain, you go really sweaty and clammy. With the chest pain, you go really sweaty and clammy. I'm just going to type this in, please. I'm going to type this in. So you go really sweaty and clammy, and at the same time, you don't feel well. There's something going on. There's a chest pain, you're clammy, you're sweaty. You are likely having a heart attack. It's not a spiritual attack. It is a heart attack. These are two different things. You are having a heart attack, likely. If you are having a crushing chest pain, you are sweating with it, you are feeling clammy with it, you might just be having a heart attack. Do not ignore it. Now, the last thing I'm going to talk about tonight, the last thing I will talk about is cardiac arrest. So many people, unfortunately, have died from cardiac arrest. It is dead anyway. So if you are in cardiac arrest, you are not alive. Your heart stops and your breathing stops. So we said your heart, cardiopulmonary, your heart and your lungs, your breathing stops completely. So you will need resuscitation. But there are very few people that do recover from cardiac arrest. When your heart stops, your breathing stops. So they check your pulse, you do not have a pulse. They check your breathing, you are not breathing, you are in cardiac arrest, meaning you are dead until proven otherwise. So they will have to resuscitate you. And depending on the cause of your heart stopping, you might come back to life. In most people with cardiac arrest, and we find that they are in a rhythm that we think is caused by a heart attack, they are taken to the heart center. This is in Britain, and they try to get them back. After they have resuscitated them, they take them straight into the cardiology lab, and they try to go into the heart to take out the blockage so that they can have circulation again. This has happened so many times, and so many people have lived, have come alive after this attack. Now, what are the things that we need to do? So for us to stay alive, to stay well and prevent cardiac arrest, cardiac or heart attack, number one, if you are diabetic, I have said this many times because diabetes has so many complications. You need to make sure your blood sugar level is under control all the time. You need to make sure that other risk factors are reduced. So things like your cholesterol level, things like your weight. Most people with diabetes, as soon as they start losing weight, their sugar control becomes really normal. And there are people that we see and they are on diet control. They are not on any medicine. They are diet control diabetes. The second thing, if you're hypertensive, please, you need to keep your blood pressure really normal, because the more you leave your blood pressure uncontrolled, you are damaging the blood vessels and you are making it being at risk of having a heart attack. Because I talked about the blood vessels being defective, being weakened, and then begins to accumulate stuff it's not supposed to. When you have a strong inner lining of your artery, which is the pipe, things do not really accumulate. But when it begins to weaken, things begin to accumulate. And if the vessel, the inner part begins to narrow because there is accumulation, which is called a plaque. A plaque is just a formation inside the blood, the artery, the pipe that carries the blood is a plaque. It consists of things like fat, cholesterol, toxins, white blood cells, different things comes together and forms this plaque. It's like a lining inside this artery. And then at some point it breaks open and it completely blocks the artery. And that is when we say you have a heart attack. If you are obese, obesity is a big thing. You have to try and be realistic with yourself to lose some weight. You have to try and lose some weight. And there are so many ways to do it. Exercise, diet. I mean, there are so many things you can do. You can go into a class, you can do others, anything you can do, you want to do to help you lose weight, you can do it. Then if you are a smoker, smoking is a big, big issue with heart attack. Most people that smoke, they end up with heart attack and they start having coronary heart disease. So they have angina, they come with all different sorts of symptoms, and they keep smoking, they keep destroying, damaging that blood vessel, and one day they have complete blockage and they have a heart attack. So if you are a smoker, it is always advised that you stop smoking. You stop smoking, because coronary heart disease is what is the leading cause of death worldwide. So it is advisable that you stop smoking. If you stop smoking, you have reduced your risk remarkably. You will reduce your risk remarkably. So these are the 5 signs, and I'll mention other things that can happen to you. So people do complain of pains in the legs. People do complain of having dizziness. They feel dizzy. People complain that they are lethargic. They feel just excessively weak in themselves. And this is not with something like malaria or high temperature. You wake up, you feel strange with your heart. You feel extremely weak in yourself, but you have this dull pain in your heart. Do not ignore it, because it is a sign that your heart, there is something going on there, and it can be dangerous. Let us protect ourselves. Let us know ourselves, know your body, know when things are not right. This is what I keep saying. Your body speaks to you. Your body talks to you. Your body is how do I put it? Is one of the major communicator. It communicates with you. It tells you, I'm not doing well. Something is not right with me. Check it out. There's nothing wrong with checking out any symptoms you have. Don't push it down. Don't think it's not serious. Check it out. If it is nothing serious, then you can rest. But if it's something serious, you would have caught it on time. So if your body is talking to you, if you're having a chest pain while you're running, while you're in activity, or you're dancing, or you are in PE, you have a chest pain, but when you sit down and rest, the pain goes away, then you know there is something not right with my heart, and that needs to be checked out. So that is the 5 signs I came out today to talk about. And please share this broadcast and subscribe to this channel. We will be doing more videos on our heart, on a heart failure, how your heart is failing and why it's failing. We have a lot of questions that people have asked us to do videos on autism. We've had videos on inflammation, bowel changes, and these are videos that I will be doing personally, because everybody that is asking questions, I will endeavor to do a video to clarify, to explain to them what is going on and how they can understand their body better. I've had questions on more than 10 health topics that they want us to discuss. So if you have any questions, if you have any contribution, if you have any comments, please leave it below, and I will endeavor to answer all your questions. And I remain Dr. Idee Charles, and thank you so much for joining this broadcast, and take care of yourself till we come again next week with another video. Thank you, and God bless.